Diolch, Lara. I'd like to thank the Cabinet Secretary for his statement today, and I think no one across this chamber wants to see ambulance response times getting better than me. You know, we all receive casework, don't we, from all our constituents about people who've waited unnecessarily lengths of time. But you did mention a number of things in your statement, Cabinet Secretary, and I hope you'll be able to cover them all. You mentioned about the orange category. You know, that's an important step going forward, but I'm just interested, for those people who are living in rural areas, and you talk about time-critical care, I hear from people, not just in my own constituency, but wider, who live in rural Wales, that they still aren't getting that timely care. So in that orange category, how can you ensure that people are going to be seen within that time? You also said in your statement about hospital transport, you know, ambulance transport is important, and making sure we can get people to hospital for people who are in that yellow category. But what sort of transport to get people to hospital are they going to have? Is this going to be taxis? Is this going to be Welsh ambulance transport services? They're going to do that because they need to make sure that they've got the resources also to get people to hospital. You did then say we'll monitor the correct treatment provided by ambulance clinicians for a person with a stroke. You know, that's important because we all know that stroke is one of our biggest killers. But I mentioned how you're going to monitor this, Cabinet Secretary, and where that's going to be reported back. So I think that's really important that we get an understanding of this. And you mentioned stroke, but you're also going to be monitoring on heart attack as well, and other conditions in this area. So stroke is important, but we need to make sure there's others as well. And you talked about also paediatric care and about the sharing of data. And I'm just interested, you know, the Welsh Ambulance Service were going through a piece of work not so long ago about sharing medical data between GPs, between the hospitals and their cells, so they can get a full picture of the case they're going to. And you say a lot of younger people with respiratory problems. So I'm just interested whether that system has been put in place now to make sure there is that better information sharing, not just on paediatric care, but right the way across the system, because it does obviously help. You also mentioned in your statement, Cabinet Secretary, asking health boards to do more. You know, I'm not sure what more some of these health boards can do. They are under an awful lot of pressure. I agree with you that we need to get ambulance handovers better. That is important, that we get people into hospitals. But what I am being told by health boards and clinicians is that this time is actually pushing more corridor care and more people in a non-safe clinical environment into our hospitals just to meet this target. So I'm interested, with these figures that you presented to us about the fall in delays, just how is that equated to corridor care? What are the numbers? How many people are in corridors? How many people will be admitted when they'd probably be safer in the back of an ambulance, but they're being pushed into a corridor or a room somewhere and left there? So I'd just like to understand a bit more from you about that. I think what is also very important, Cabinet Secretary, is you talk about that move and efficient flow into community care. You know, I think it's important we do push people into community where it's appropriate to do so. I've heard that the Welsh Government are going to put 340 million into that, 340,000, sorry, into doing that. We'd all like to have 340 million, wouldn't we? But 340,000 into doing that. But I want to ensure that that money is going to be spent appropriately by making sure our GP services are fully resourced, that the nursing teams are fully resourced as well, because we need to make sure that's right. But then finally, Cabinet Secretary, you did mention right at the end of your statement about weekend discharges, and I think it is important we get people out of hospital if they're optimised to do so. But on that weekend, how can we ensure that the social care element is right and that people aren't being discharged back into their homes unnecessarily, left being alone at Christmas, which none of us want to be alone at Christmas, without that social care package put in place, without the nursing teams going in to make sure they're safe? Because what we don't want to see is people being pushed back into their homes and then being readmitted back into the system because they haven't got the support network in place. But thank you for your statement today, Cabinet Secretary. I look forward to your answers. Thank you.
Thank you. So I'll endeavour to deal briefly, if I may, with as many of those as I can. So, as the member is aware, Powys, which I know he will have a particular interest in, has had some of the most successful response times in the old amber category, which is being replaced partly by the orange category. So we will want to see a similar level of performance in relation to under the new arrangements. And in fact, it's the ability to focus the most rapid response on the orange category, which is a much more specific, tailored category than the old amber category, which will enable that rapid response for the highest acuity patients. So he mentioned in particular, he was asking what we would measure. And I think, so in the orange time-sensitive category, we'll track, for example, ambulance delivery of clinical care bundles, median call to door times for both stroke, which he asked about, and STEMI patients, and that will be published. In relation to the vehicles that will be available to respond, I think it's actually really important that in moving away simply from a time target, we are able, therefore, there's a risk in terms of a simple time target, that you hit the target but miss the point. And actually, a rapid response vehicle being sent out to a patient will hit the target, but may not be the right vehicle for the patient's needs. So having a more outcomes-based approach does mean that those resources can be allocated more appropriately. Sometimes it will be an ambulance, sometimes it will be a rapid response vehicle. It may be that it's a non-emergency vehicle. In other cases, it depends on the level of acuity which the clinical triage process will be able to determine. So there are a range of options. The crucial thing is that we will measure the time between the call and the delivery of the appropriate intervention, if you like. So that will capture that. It'll capture that. The most relevant data, if I can put it like that. He made an important point about the sharing of data. There is work underway at the moment in the Welsh Government to respond to the regulatory landscape. There are some regulatory questions in this space which the member will be aware of, and so work is progressing well, which will enable better transfer of data between primary and secondary settings, which I agree with him is absolutely critical for us to be able to improve performance overall, and crucial, obviously, to making that shift of services into the community, which he also mentioned. In his question. On the relationship between the ambulance handover target and corridor care, I don't actually accept that there is a necessary link between the two. I've been to more than one hospital site in recent weeks where the focus which the hospital has brought has been on both meeting the 45-minute target and making sure that there is no corridor care. It is undoubtedly challenging. However, it is absolutely possible. It is about how services are configured within the hospital in order to do that. We are working on how we can capture and publish data in relation to corridor care. We'll be debating this in the Senedd tomorrow on the back of a petition, as the member will be aware. And I think he is right. I think he talked about it as a safety issue. And it is, in fact, a safety issue, a patient safety issue, not, as it were, simply a target. However, what I would say to him is, in focusing on the patient in the corridor, which we don't want to see, and the patient sitting in the back of an ambulance for too long, which we don't want to see, the debate often doesn't give sufficient weight to that patient that may be lying on the floor at home, also waiting for an ambulance to collect them. And that patient is often the one facing the greatest safety risks to their health and well-being. So I think it's important for us to have a system which enables ambulances to be freed up to meet those needs as well. Just one final point. The 340,000 I mentioned is specifically for vehicle capacity, which helps take patients home from hospital, which I know he'll welcome. And on the weekend discharge, two of the metrics which we feel are likely to make the biggest difference in making sure people are discharged in that timely way that we all want to see, is increasing the daily discharge rate so that at least 33% of that cohort is discharged before midday. Some hospital sites are running at about half that at the moment, so there's a huge opportunity to do that. And that's really not about additional resourcing, that's about how you deploy the systems you already have in a more, frankly, a more effective way. And that boosting weekend discharge rates by 30%. Now, that is more challenging for the reasons the member set out in his question, but actually that joint focus between local authorities and health boards, which is what this fortnight is about, will show us how much more can be done in that space.
Mabon Gwynfor.